you guys. So again, we've had a very exciting day here at Mercy Health St. Vincent Medical Center, and I am so pleased to be joined by this team, some of our extremely amazing caregivers who have been on the front end of this. And we're going to give them an opportunity to share some of their story as well. So I'm going to kick it to Dr. Kevin Casey, the Chief Clinical Officer here at Mercy Health Toledo, and he'll introduce our team and start off by sharing a little bit about what today looked like. So thank you for that.
Thank you, Erica, and good afternoon, everybody, and thank you for being here today. You know, this has been a very exciting day for us here at Mercy Health, one that we've anticipated for a number of weeks. We've had a vaccination team and committee that has been planning, following the guidelines and the guidance of the government of who should receive the vaccine first of our frontline health caregivers. And today we got to recognize that goal. This morning, the vaccine arrived, which the Lieutenant Governor referred to as a box of hope. And it arrived, and as soon as it got here, we started the preparations to start the vaccination process for our frontline healthcare workers, some of which you will get to meet today. It's been very exciting for us. We view this, as a friend texted me on Sunday, as the beginning of the end of this pandemic. It's been quite a few months of uncertainty, of change, of disruption. And while this is not the end, this is the beginning of the end. And it's so nice for us to be able to offer some protection finally to those healthcare frontline workers, those heroes who have been caring for us and the members of our communities for so many months now. It's just an honor and a privilege. And I'd like to introduce some of them to you. We'll start off with Dr. Jim Tita. Dr. Jim Tita is a critical care specialist. And to be honest with you, he has been the tip of the spear, running our COVID unit at St. Vincent's and in the Regional Heart and Vascular Center, helped design and led a lot of the processes that we have followed that have really allowed us to provide that high level safe care, not only for our patients, but for our staff. So he has my deep respect and appreciation, and I would like to introduce you to Dr. Tita.
Thank you, Kevin. In the dark days of this pandemic, and there have been many, we could only dream about an effective vaccine. Today, that dream became a reality. Really an exciting time. We still have a long way to go. There are going to be some more dark days. We have to continue doing what we've been doing, which is wearing masks, washing our hands, and staying at least 6 feet apart. But what this vaccine represents is hope, and hope that that today is the beginning of the end, and that we can finally get to a point where we get this pandemic under control. So very exciting indeed. Over the next months, we're going to be involved in rolling this out to as many people as we can possibly get vaccinated. And this gives us some hope that we can finally put this behind us.
Hi, my name is Kim Ogden, and I'm an RN here at St. V's. I've been with St. V's for almost a year now, working in the dialysis department. And I'd like to piggyback on what Dr. Tita was saying, that this is the first step in trying to eradicate this disease. And we will have dark days ahead of us. But like I said, this is the first step. And I'm just happy and proud to be a part of this.
Hi, my name is Rhonda Gladiel, and I'm a respiratory therapist and the respiratory manager here at Mercy St. Vincent's. I've been here for like 18 years. I'm also very excited to be a part of this today. And again, like everybody else said, it's the beginning of the end, and just very excited that I feel like we have a lot of hope and a lot of good coming our way with these shots that are now available.
Thank you, team. So with that, we know that the guys probably have questions for us. So Rhonda, Kim, please put yourselves back on camera, and we welcome any questions from the media about their experience. So today, Dr. Tita was in fact our first recipient of the vaccine. Kim was our second, and Rhonda was our third. So we have our top 3 recipients right here for you. So we'd be happy to share they'd be happy to share their experiences with you. And if you guys would want to go ahead and ask questions, we'd welcome them now.
Hi, it's Melissa Voetsch from 13ABC. My question is for the people who've received the vaccine so far. Could you give us sort of a quick update about how, what it was like, what it's like to be part of history, what kind of effects it's had, that kind of thing. And you can start with Dr. Tita and then just go down the line as we did before.
And maybe would it help for you guys if you wanted to take yourselves off camera just for the rest of you guys recording? So Amy, if you could take yourself off camera, there you go. Perfect. Thank you. Dr. Tita, please go.
Okay. Well, actually, the whole process was fairly simple. I mean, obviously, after registration and, getting the injections ready, it was really no more eventful than getting a flu shot. I don't feel any adverse effects. I anticipate that I won't have any difficulty.
Yes, again, to piggyback on what Dr. Tita said, the process is very simple and similar to the flu shot. And in fact, I commented that the actual shot itself didn't hurt as bad as a flu shot. So the same as what Dr. Tita said, I don't anticipate any adverse reactions. I feel great so far, and just going about the rest of my day. And just excited about this, to be a part of the end of this pandemic is just exciting.
For me, the same as the other two. It was a very easy process. It was kind of the same process as a flu shot, just as easy. And it did not hurt. I feel fine. I feel excited to have it. I'm just looking forward to everybody else getting it.
I'll hop in if you don't mind. This is Bri with NBC 24. This question is for Dr. Kevin Casey. So during the governor's press conference, you had mentioned that you guys basically want to do as many as possible to safely do as many possible every day. Do you have an update on the numbers? Did we do more than just these 3 here, and kind of a better idea of that, if you will?
Sure, and that's a great question. So we are currently giving the vaccine as we're having this conference, and our goal is to hit about 300 people a day. So we think that's what we'll be able to do. As long as we have vaccine, we will be pushing to try to do that many.
If you don't mind, a quick follow-up to that, is there any concern of there being any side effects and, people having to call out, or there being, half of that 300 one day, half the 300 the next day, any fears for staffing issues with that whatsoever?
That's a great question. And Dr. Tita, feel free to jump in on this one. But from what I understand and what the reports have said is that it's not unusual. It's not different than the flu shot. A few people might have some aches, less so after the first shot, maybe a little more after the second shot, but they tend to be mild and they tend to be self-limited. Certainly, they anticipate that it'll be, if someone does have to call off, it will be for a single 24 hours as opposed to the 17 days or so that we've been seeing with COVID. So any way we look at it, it's a gain for us.
Awesome. Thank you so much.
From the studies, it seemed like the side effect rate was in the range of 4 to 5%. So any of those side effects that do occur, it should be a relatively small number of people.
Thank you. I appreciate that.
Hi, this is Amy Steigerwald with WTOL 11. My question at first is for the people who got the vaccine. What made you decide to, what made you want to get it and be, a part of history like you were saying? And then for the doctors on the line, I don't know if you can touch on, we've had a couple questions on what the process looks like for employees who are in this first category. Do they have to take it? Can they opt out? What have you been seeing in that case?
Well, I guess I'll go first. I mean, one of the major reasons I took the vaccine is I certainly believe in the science of vaccines, and I understand how important the vaccination process is to controlling disease, and especially a viral disease like COVID-19. I think it's also important as a leader of the critical care team that I sort of set a good example for all of our other team members. And so, you know, from that standpoint, I certainly was excited to be the first one to get the vaccine. In terms of our policy, it is strongly recommended, but it is not mandatory.
Okay, I decided to participate and get the vaccine because it needs to be done to help eradicate this horrible disease. I've seen what it does to people, and we've lost too many people. And if we don't get enough people to participate in taking the vaccine, then the disease will stay around. It won't, we can't get rid of it. So I feel like as a nurse, it's my responsibility to lead by example. And I think this is a good way of doing so, is to lead by example.
For me, I feel the same way. I feel like the decision to get the shot was a very easy decision for me. I have personally seen uphand what COVID does to people, and I know that I don't want it. And I know that we need to have a solution, and I want to be a part of the solution and be a good example for everybody, and, you know, show them that it's okay. And we do need to get this under control. And this is hope for all of us.
Hey, it's Kaitlin with the Blade. I'm going to jump in here. In terms of if the vaccine is working, do you have any sense of how long until we can expect to see results in terms of, you know, fewer daily infections or hospitalizations?
That's a difficult question. You know, we have to get to that herd immunity level, and we don't even know exactly what that level is. We don't know if it's 60%, we don't know if it's 70%. So you're talking many, many millions of people that have to become immune. And the way we do that is either through the disease or through vaccination. And so it's going to take a long time for us to get to that point. I don't know exactly how long that's going to be. I mean, there have been estimates that maybe by midsummer, late summer, that we should get to a point where the disease will be under control enough where we can return to some semblance of normalcy. But again, we don't really know.
So, again, Kaitlin, if I can just jump on there, that's from the community perspective. I can talk a little bit maybe about the individual perspective, is that the evidence that we understand, as we understand it, demonstrates that there's about a 50% chance, a 50% efficacy. You get about 50% of the strength of the vaccine 10 days after the first dose. And then after your second dose is when it starts to kick in and give you full strength. So while Dr. Tita is absolutely right in talking about the community, it's the individual that really matters. You know, what's the old saying? A trip of 1,000 miles starts with a single step. And each one of those steps is an individual in the community receiving the vaccine and trying to protect themselves as we protect others.
I think one of the other important things to point out is just because you've received the vaccine and developed immunity, we don't know for sure whether or not you can still carry the virus or even transmit it. I mean, one of the things that we do feel fairly confident about is that the level of immunity to prevent serious or fatal disease with the vaccine is pretty high. But even though you've received the vaccine, it's still important that you practice those good public health measures such as masking, washing your hands, and socially distancing. Because for any one individual, we don't really know whether we can still harbor that virus or not.
What does the research show when it comes to people who have had COVID and the recommendations for them getting this vaccine?
Well, it's still recommended that people who have had the infection get vaccinated for a couple of reasons. Number one is we don't really know the duration of that immunity after you've had natural infection. And so it may not last indefinitely. We feel fairly confident that it lasts at least 3 months, but we're not sure after that. Again, because the duration of this pandemic hasn't really allowed us to do those studies. By the same token, there's some evidence that the immune response, which is induced by the vaccine, may be actually stronger than that induced by a natural infection. So for those two reasons, it's recommended that even people that have had the infection, that they be vaccinated. Now, in terms of the timing of their vaccination, I would anticipate that somebody who has had the disease could probably wait a certain amount of time before they are vaccinated. But in general, it is still recommended that they receive the vaccine.
Do we have any other questions at this time?
I'll hop back in for another one. Bri with 24. Do we know, I think the governor had mentioned, 3 weeks before the second dose has to be administered? Could you provide more, concrete, a date on that if you would?
For the Pfizer vaccine, which we all received today, the recommendation is that a booster be given at 3 weeks. For the Moderna vaccine, which has not been approved yet, but is awaiting approval shortly, the recommendation is for 4 weeks.
Thank you.
Any other questions?
Okay, well, I would just like to thank all of you for joining us today. This is a historic day and a very exciting day for all of us in healthcare, particularly those of us at Mercy Health. And I think you can tell from the people on this call that we do have heroes, and we have a number of heroes who are also leaders, and greatly appreciate them, greatly appreciate the care and the risks that they have taken to provide that safe and high quality care that our community deserves. And I can't thank them enough for their service and for their willingness to lead. So with that, Erica, if there's anything you'd like to say?
I think we're good. To those members on the team or those on the call, I will be sending you a link to this press or this media conference as soon as I get it, so you are able to use that. As always, if you have additional questions afterwards, please reach out. We'll do our best to get a hold of whoever it is that you need to take care of that. And with that, I will end this. Thank you all on the call today. Thank you, Kim, Rhonda, Dr. Tita, and Dr. Casey for your expertise and your leadership here today. And with that, I will end this call. Thank you all.
Thank you.